This is a taped interview between Jeremy Akers and Patricia Orr with Miss Sylvia Thuoy. I did it again.
Yeah, back it up.
As you were, Sharon Thuoy. And this interview is taking place on the 1st of December, 1976, at approximately 3:15 p.m. Okay, Ms. Thuoy, would you basically repeat your story, which you related to Ms. Orr and myself, with respect to your activities at Parkland Memorial Hospital in Dallas on November the 22nd, 1963?
Yes, I was a student nurse at the time, and during lunch on the 22nd of November, I noticed there were 2 or 3 people who came into the cafeteria area looking for emergency room and operating room staff. Working in the emergency room part-time as a student nurse, my interest was piqued as to know what problem had occurred. No one made any comments about any such incidents. Not knowing what was going on, I finished lunch, went to the library, and was waiting for my 1 o'clock class to start. There was one outside line telephone in the library. There was a doctor on the telephone. A reporter from one of the newspapers known to us because he was at Parkland at various times for stories, came in, asked the doctor to let him use the phone, was told to wait, asked the doctor again to use the phone, and was told to wait. And with that, he proceeded to hit the doctor in the chin, knocked him down, proceeded to make a telephone call, and his story to the person at the other end of the line was that someone in the President's motorcade had been injured and was being brought to Parkland Hospital. Myself and another student nurse, Donna Schloss, overheard the conversation, and both of us working in the emergency room at various times went down to the emergency room area to see if we could be of assistance. When I arrived in the emergency room, I asked if there was anything that I could do, was told just to help clear the corridors, help with any patients who needed assistance. I remember there were 2 people who had fresh cast for broken bones put on that were in the center corridor area, and I helped these people out into the waiting room area. Coming back into the center core area, there was a stretcher that came in from the hallway with a body on it. It was being rushed toward one of the trauma rooms. I went with the stretcher into trauma room 1. I recall that the patient had a bullet wound in the front, above the right collarbone, slightly to the right of the center neck. We started to get his shirt off. The back of his head, above the base of the skull, contained a large cavity, which appeared to be an ugly wound, a lot of tissue showing, a lot of blood in the area on the head. The wound appeared big enough for both fists to go into. Both doubled-up fists could have fit into the area. I remember after getting the shirt off, the IV bottles were prepared, tracheotomy tray was prepared, the blood was drawn for type and cross-match, and vital signs were taken. I remember at the time the patient had a pulse and was breathing. I don't remember blood pressure count, although it was being taken. I remember there was noise in the room. It was difficult. The person taking it was saying it was difficult to hear. At this time, the tracheotomy incision was made after some comment that there would have to be a new incision made, that the hole that was present, which appeared to be a bullet hole, was not in the right location to be used for the tracheotomy. I remember Dr. Jim Carrico making an incision and getting ready to put in the trach tube itself when Dr. Perry opened the door into trauma room 1 with his hip. His hands were held up as though he had just scrubbed for surgery or was working on another patient in some way. He said to the people in the room at the time, "You do know that's President Kennedy you're working on, don't you?" As I remember it, everyone stopped what they were doing for just a few seconds. probably 1 to 2 seconds, perhaps 3. Dr. Perry walked up to the patient and put the tracheotomy tube in. At that point, we were all aware of who the patient was. At this time, I took a tube of blood over to the blood bank for type and cross match. I gave it to a lab technician who said to me, as he broke it into the trash can, it's not a label tube. It doesn't matter whose blood it is. I rushed back to the trauma room 1, got another tube of blood that had been drawn from the president, put his name on it, and ran back to the blood bank. And the blood was turned in for type and cross. With the time sequence in being gone from the room was probably not more than 90 seconds to 120 seconds. After returning the second time, there did not seem to be anything else that I could do that would help promote the welfare of the patient other than being in the way. Both times when I left the room, I saw Mrs. Kennedy standing across the hall with her back